In northwestern Syria, on the border with Turkey, hundreds of thousands of displaced people remain in exile, making up this sea of makeshift shelters. Despite the fall of Bashar al-Assad's regime, returning home remains impossible for Wael Karouf. Originally from the Hama countryside, he's lived here for 14 years.
I wanted to go back home, but my house was in ruins. I don't want to spend another winter here. I'm sad, and I wonder why we're still here.
Since 2024, his neighbors have been gradually leaving the camp.
There used to be a family living here, but when Syria was liberated, they left, and now people take these concrete blocks and sell them. Many have returned to their villages, but conditions there aren't necessarily any better.
According to the UN, more than 5 million Syrians are currently living as internally displaced people within their own country, like Wael and his family.
This is the entrance. I put a tarp on the roof for insulation. This is where we live, come rain or shine.
Wael spent everything he had to build this makeshift home.
I can't take this house with me. If I could, I would have taken it rather than waiting here, even though it could have been done in 3 days. I put this rope up to secure the roof, so the roof wouldn't blow away in the wind. If there's a storm, the roof gets ripped off. This battery gives us electricity, but it's a ticking time bomb. It could explode at any moment.
A few years ago, his daughter suffered serious burns in a fire due to their poor living conditions. He says he's constantly worried for his 7 children and their future.
My children find it hard to concentrate at school because we're barely surviving.
Their extreme precarity has pushed Wael's 15-year-old son Omar to work in construction.
We do our shopping on credit. The $10 I earn a week goes towards paying off our debts. My future? What future? We didn't have a childhood or anything. We grew up between war and work.
Residents here are sinking deeper into poverty due to cuts in international humanitarian aid. Camp manager Ahmad Al-Tufa is also worried.
Leave the cable as it is. We can't afford to repair it. No organization supports us anymore. Not for access to water, no for waste collection. There were food parcels before, but that's all stopped. It's as if we've been forgotten in the camps. That's how people feel here. We are completely marginalized.
At the camp's gates, vital infrastructure is at risk of closing due to a lack of funding, such as this maternity ward, currently supported by the Syrian-American NGO SAMS and the UN. The aid program is due to close at the end of June.
How many children have we seen today? We admit an average of 250 people a day. We perform 250 deliveries a month, 60 of which are C-sections. If we have to close, it would be a real disaster for the region. Budget cuts are radically changing people's lives for the worse.
Over 400,000 people rely on this hospital. Doctors like Aisha Hamada, an obstetrician gynecologist, are themselves displaced.
السلام عليكم. كيفكم؟ سيرو ما شغال؟
Over the 4 years she's worked here, this doctor has witnessed the women's health steadily deteriorate.
Stay sitting like that. Is that all right? Continuous care is essential because over the last 14 years, mothers have been deprived of everything, from mental health support to food and shelter, not to mention malnutrition. These conditions are taking their toll on them. We have a large number of patients experiencing severe anemia.
Camp resident Iman Kada has just given birth to a baby girl.
I can't afford to go to a private hospital. A cesarean costs between $350 and $400. That's why I came to this public hospital.
The withdrawal of subsidies could become a matter of life and death for premature babies like Fida, who depends on this ventilator.
This infant has a congenital heart condition. He urgently needs surgery. We've been trying to transfer him to a specialist center for over a week, but there isn't enough space. This child is surviving thanks to the ventilator and the medication. If the ventilator stops, the child will die immediately.
This hospital is a fragile lifeline until the displaced people can return home. President Ahmad al-Shara has pledged to facilitate their return and close the camps by 2027, a colossal challenge in a country like Syria that's struggling to rebuild itself.